Hi, and welcome. My name is Dr. Charley Ferrer. I'm the founder of Cancer Tamer, which is basically a new way of looking at cancer. We always talk about battling cancer, about being at war with cancer, and about survivorship. And those are all wonderful things. We've had them for decades. However, I believe that it's also important to realize that when you are looking at your body, when you're looking at cancer, it's not something outside of yourself, it's something within. And so you need to be in peace with your body, in peace with your cancer, and learn different ways of working with yourself, doing exercise, learning how to eat, and also getting information. So Cancer Tamer is all about a new way of looking at cancer and learning more things. I talked to you last time about the different segments that we're going to have in the show. And today I have Deborah Santulli Barone, who's going to be talking to you about the things that you should know. So I want you to listen to what Deborah has to say because it's awesome information. And we're going to go to Deborah.
Thank you, Dr. Charley. Hi, I'm Deborah, and it's Did You Know time. Okay, so let's talk about breast today. And this isn't only for women, this is for men too. Because I have found out that men have been diagnosed with breast cancer too. So what's the most important thing? Is to check monthly to see if you have any lumps. And more importantly, to have mammographies every year. You are your own advocate. So when you go for a mammography, and everything looks well and they send you reports saying that your breasts are dense, it's up to you to fight for a sonogram, an MRI, or 3D imaging of a mammography. Because sometimes a regular mammography does not show your cancer. I know this firsthand. This happened to me. I had my mammography and it didn't show cancer, but I got a letter stating that my breasts were dense. I felt that there was something there. So when my doctor wouldn't order a sonogram, I dumped that doctor and I went to another doctor. Don't ever feel obligated that you have to stay with someone if you're not happy. So when I went to the next doctor, he suggested a sonogram. I had the sonogram and they saw the cancer, and then I had an MRI with contrast, and it was 100% cancer. This doctor saved my life. But again, you are the only one that can really save your life by advocating. If you don't like what you hear, or if you feel that there should be more testing, then it's up to you to fight for what you need. That's very important. The 3D imaging uses x-rays, but it shows an enhanced position of where a tumor would be, and that's very important for you. And the MRI with contrast will definitely diagnose what kind of cancer it is too. Now, on top of that, you should also know that the American Cancer Society has suggested that women should wait a little bit later to get mammographies. We don't believe in that. We're all fighting and advocating for that because we want the testing to stay the same at age 40. That's very important for everyone to know that, because lately and every year, women are being diagnosed with cancer at an earlier age, some as young as 28 years old. And that's something that was unheard of years ago, but now it has progressed to that number of people that are getting it. It's also important for you to know that once you get diagnosed with cancer, you should go for a second opinion or a third opinion. It's not that the first doctor's wrong, but I always believe in getting other opinions, and this way you can make an educated guess on what you're going to do once you find out that you have cancer. That's very important to you, and it's very important for me. That's how I saved my life. And I go back to Dr. Charley now. Thank you so much. See you again.
Well, thank you. Thank you so much, Deborah. And the one thing that I love that Deborah always talks about is advocating for yourself. It's so important for you to advocate for yourself. because even though you might have a nurse navigator who's there to assist you, your family, your friends, it's you who needs to take control of your life, and it's you who needs to take control of what's going on for you. And with this crazy journey that we're on in cancer, so many things are out of our control. But the one thing that you can do is talk about what's right for you and have someone listen to you. And as Deborah mentioned, if the doctor isn't following exactly how you need, it's okay for you to get a second opinion, even a third. I look at it as, remember, shoes. You get the right pair of shoes that fit for you, and you change them as you need to. So make sure that you're getting the doctors that help for you. And always remember, sometimes what they tell you isn't what you want to hear. The one thing that I do love to do is do the recording. I always record the sessions that I have with all my doctors, with their permission, of course. And this allows me to be able to listen to it later in the night, or share it with my partner, or you can share it with your significant other if they can't be in the room with you. Because what happens is, cancer is really scary, and at some point our brain shuts down. Also, the fact that you're getting so much information, you can't remember it all. So having it recording allows you to go back and say, oh, that's what they said. Oh, I heard it this way, or yes, that confirms what I thought. So allow yourself some leeway. Ask your doctors if you can record, and make sure that if you have questions, ask, and call. The one thing that I do want to say is that all the opinions that you hear on our show are our opinions. They're the opinions that I form for myself based on my education, my history, what's going on with me, as well as Deborah when she's talking about what's right for her. And all our guests have their own opinion. It's not the opinions of the station that we're connected with. And it may not be your opinion, but the wonderful thing is we live in America and everyone can have their own opinion. So what I want to do right now is I want to introduce my wonderful guest, Kerry Gullespie, who is the Director of Complementary Medicine, and he will tell you a little bit about what that means. But the one thing that I love about Kerry is that he's helped me stay sane in what's been going on with me and with my diagnosis. And Kerry, thank you for being here. Welcome to the show.
Thank you for having me.
And so, what is complementary medicine?
Complementary medicine is taking old theories, things like meditation, like yoga, like Tai Chi, and applying them in new ways so that people can empower themselves. Healing is not just about what the doctor does to you. Healing is about what you do for yourself as well. And it's not just about medicine. It's not just about chemotherapy or radiation. It's about keeping yourself healthy, like doing the right things as far as eating, as far as light exercise, as far as doing things like meditation, which helps you relax. Relaxation is one of the key ingredients of being able to maintain a healthy immune system.
And we do a lot, when we get together, we do a lot about stress. So why is it so important to relax and to reduce your stress?
Because the more stress that we experience, the more likely we are to compromise our ability to defend ourselves. And most people think that stress is simply just part of the brain, but stress translates into the body and causes all kinds of harm to the body, which is counterproductive to what you're trying to accomplish when you're actually trying to get healthier.
And I'm looking at, you know, and I know we've had this discussion before, because I would say, well, of course I'm stressed. Look at what I'm going through. And so how, you know, are there a couple of tips that you can give on how to help de-stress ourselves, especially when you're going either through a cancer treatment or cancer diagnosis or any kind of diagnosis or any kind of stress in your life?
Right. It's kind of difficult to tell someone who's going through a chronic illness like cancer that it's not in really their best interest to be stressed, because that's the normal, common reaction. But what we want to try to teach is that you can modify that reaction, that there are things you can do like relaxation, like meditation, things like that that will actually help you be able to take a little bit of time away from the catastrophizing that most people do when they're dealing with a cancer diagnosis. Cancer in today's world is not the same as cancer was 10 years ago or 20 years ago. The new treatments, the new therapies are much more effective, and the likelihood of survival is much greater in today's world. And so trying to apply those stress thoughts that most people have when they get diagnosed with cancer is not necessarily always appropriate in today's world. The idea is trying to remain positive, to remain hopeful, and those kinds of emotions are very, very positive for the body, because those emotions actually cause the body to be stronger, to be more effective at being able to deal with the issues that it's dealing with.
And the one thing that I know that you do for me is you rephrase things sometimes, where you help me see a different perspective. And I think that's also part of, when you get stressed, then your mood changes, and so that affects you too. And so being able to look at it from a different perspective allows you to then be able to start rethinking it or reworking it, or not be as stressed. Now, the one thing that I always have trouble with is, with everything going on in my life and so many things, and now I'm doing the show and I'm doing everything, how much time do I need in order to be able to meditate or to stress out, or not stress out at all? Because I really don't have an hour a day to be able to devote, or sometimes even 30 minutes to devote. So does it have to be so long?
It doesn't. I usually use the same rule for meditation as I would use for exercise. You're not going to start out the first day of exercise with an hour of activity. Start out with a few minutes. And it doesn't necessarily have to be strict meditation. There are a number of forms of meditation, like guided imagery, like progressive muscle relaxation, or body scan, any kind of activity like that. And all it really needs to do is to help you create gaps in the normal stream of stress.
What do you mean gaps?
Well, what most people in America do is they wake up and they start thinking about their day, or they start thinking about their diagnosis, and they immediately go into stress physiology, and they stay there all day. There's no break. It would be like,
they just stay stressed all day.
Right. It's like getting into your car, leaving your car in park, and then just keeping your foot on the accelerator. Eventually, you're going to wear that car out. And we do the same things to our bodies. So creating gaps within that stream allows your brain to settle. It allows your body to relax. It allows your body to get back to doing what it does best, and that's to heal. And the idea is that once we start to create those gaps during the day, for most people, once they feel better, they start creating longer and longer gaps, until we get to the point where we begin to be able to control our thoughts and control our body, so that we can do the most as far as what we can provide for the healing process.
And so it is very much about just taking a couple of minutes then here and there.
Yes.
So we can start with even 1 minute and saying, okay, well, for this minute, I'm going to de-stress myself and allow myself to just relax.
Yes.
Even if it's just 1 minute. And then that 1 minute can build to 2 and 3 and 4. And we can make some kind of routine, because I know you've been working with me on, well, what's your routine, and,
right.
and are you putting some stress breaks in your day? And I think we talked about the fact that for me, my stress break is when I go for my walks in the morning.
Absolutely.
And so it doesn't need to, I guess, understanding that meditation time, that stress break, doesn't need to be you laying down on the floor and going, okay, I'm relaxed, I'm relaxed, I'm relaxed. No. It can be you doing an activity that doesn't bother you.
Absolutely. Meditation is really about repetition. So if you're walking, your steps actually create the rhythm that allows you to relax. What we want to try to do is we want to try to give you an opportunity to be present in the moment, so that your brain is not thinking about what it's worried about, and that you give yourself the opportunity to be able to calm down and relax and stay present in the moment so that you're observing what's going on around you. For instance, if you're out walking, to observe the birds, to observe the flowers, things like that, and not be thinking about those things. Because it's really not about what we're dealing with, it's about the fact of the way that we think about those things. So if we can change that, that in itself is a form of meditation. And
it allows us to then not think about all the negative or the fear or you know, not only, because I do know that when you're dealing with cancer and stuff, it's not just you dealing with it. Then you start thinking about, well, what is my child going to do? What is my partner going to do? What's my family thinking?
Yes.
And then you end up going through this journey, and then you're trying to caretake everyone else along the same time, which just makes you more stressed out.
Right.
And so how does that then incorporate itself into our immune system? Because how does that work then if we start getting de-stressed? Does it help us heal faster? Does it?
Well, the body knows how to do this. The body knows how to heal itself. The body is capable of being able to maintain its own healthy immune system. But the brain gets in the way. When the brain is worried about something, it catastrophizes. And like you were saying, it goes from one topic to another. And most of the time, if you ask people if they've ever been in a situation where they thought about something happening, and then when it actually happened, it wasn't as bad as they thought it was going to be, this is something that human beings repeat time and time again. We think about something happening. It often never happens to the same degree that we thought it was going to happen, so all that time is wasted. But in the meantime, you're distracting the body from maintaining its immune system and being able to defend itself. And that's the key ingredient, because again, medicine only does part of it. If doctors were honest, they would agree that they really facilitate the healing, but the body does the healing.
Right, right. And I know for myself, we've had, you know, certain issues where I'm not healing, and so trying to turn around and refocus on well, what is it that we need to do, as well as making sure that I get my downtime. You know, so my downtime is actually my walk time, where I can start just enjoying just the walk and just healing that way. And I know that when I first met you, you had given me some meditation tapes to listen to for before my surgery and after, and they've really been so wonderful. And I always say, well, I have Kerry on my nightstand because I have you on the recordings, and so when I can't sleep and I'm in a lot of pain, I'll put your recording on and I'll start listening to you, and then I'll fall asleep. And I think, is it also that we start getting accustomed to the meditation, and then we can jump back into that phase?
Yes.
And into that place?
Yes.
And can you talk a little bit about that, how we can jump back in without having to go through a long process?
Well, again, when you do something repetitively over time, it becomes part of your behavior. And so when you understand what it feels like to relax and how to do it, you can do it at a moment's notice. I was doing a presentation yesterday, and I told them, because someone asked, how do you know when you're doing it right? I said, when you can go to Grand Central Station and you can be sitting in the middle of Grand Central Station at rush hour and you can meditate and you can focus all that out, then you're doing it right.
And that takes a little while to learn that.
Absolutely. And again, one of the things that we might want to do is change our focus. Instead of thinking about it as downtime, thinking about it as the most productive time of your day. Because this is when your body really gets back to what it does the best. And you're really giving it an opportunity to be able to do that. And this is a gift that you give to yourself.
Yeah. And I do, Mike Dooley, I believe his name is Mike Dooley, that he talks about things, thoughts become things. Mm-hmm. And so what you think is what happens.
Yes.
And you bring it to yourself. You are creating your own reality. I kind of talk about it being the vanilla sky, and I had this discussion with my friends yesterday, actually, where you know, it's like that movie Vanilla Sky with Tom Cruise. You create your own reality.
Yes.
So you can make this journey as horrible as it can be, and all the horrible, scary, frightening things that people talk about, or you can make it a more pleasurable journey,
Yes.
even if you don't want to call it that. But, you know, it's like, do you want to live in hell, or do you want to, you know, do you want to go down there and have a good time?
Right.
And so making it, you know, using the correct words, or using words that are more positive
Yes.
for yourself, because I think that's also part of it. If you're using the wrong words, and I don't want to say wrong words, but if you're using very negative words, and you're constantly saying, oh gosh, you know, this is what I'm going through, these are all these doctor's appointments, or you know, it's freaking me out that I have to go for another exam. And for me, I look at it from the perspective, because I have to go to so many exams. I mean, like 3 times a week I have to go. And so I look at it like, okay, so I'm going to this new exam, and they're going to tell me I'm doing better. And so things are going to get better. So looking at it from that perspective. And if it's not better, then what other ways, you know, what do I need to do in order to get it better? Or it, you know, it motivates me to go, okay, well, do I need to eat better? Okay, I'm eating better. Do I need to exercise more? Okay, I'm going to start exercising more. And I started with just, my exercise started with 6 steps. 6 steps up to the bedroom, 6 steps down to the kitchen, 6 steps to my office. And then from there, I've gone to, you know, I've created in 3 months, I'm up to a 1.5 miles in a walk, which is wonderful. And you come with me too. You're in my ears talking to me about relaxing, but I remind myself, hey, I'm on a walk, so no closing your eyes. So where can people learn about things like this? I know we live on Staten Island here in New York City, but other people might be outside of Staten Island. So for those that live on Staten Island, those that live outside, where can they get information?
Well, there are a number of centers that are being started on meditation, on yoga, on Tai Chi. So there are a number of places in the different boroughs where you can go. Specifically, you would probably have to check in your borough online. But in Staten Island, we have a meditation center. We also have our center, complementary center at the hospital, Staten Island University Hospital North. And these programs are designed to help teach people how this all takes place. And again, like you said, we like to keep it positive. As a matter of fact, rather than talking about de-stressing, we talk about relaxing. Because, like you said, even the words that you use are critically important, because your brain takes the messages that you think about, and then, again, like I said, it makes them try to come true. And we want to try to avoid those kinds of things, so we always want to try to frame the situation in a positive way. And a lot of people would say, well, aren't you trying to give someone false hope? No, there's a difference between giving a person hope and giving a person false hope. And I think it's critical that all human beings should have hope.
Yes, I agree. Well, thank you for being here today with us. And
My pleasure.
We're going to have more information. If you go to CancerTamer.org, we'll have some information about Kerry. We'll also have information on some of the resources that you can go to. And what I want to do also is I want to talk to Deborah for a minute. And Deborah, what did you think about that? Do you use any kind of meditation for yourself and help yourself relax and feel better?
I am totally stressed sometimes. My doctors are actually always telling me, you have to relax, you're going to be fine. And it sounds good, but I do get nervous. So the relaxation techniques that I incorporated from Kerry, about meditating, about trying to concentrate on something good. I shut my eyes. I sometimes picture a window with sunshine, and I look out that window. And other times I breathe. I believe in thinking, breathe in cool air, breathe out warm air. You say that enough times, that tends to relax you too. And what Kerry said was true about yoga. There's also acupuncture, massage. If you do acupuncture or massage, you need to get a licensed professional to do that understands cancer patients. That's very important.
And you know, we find so many different ways of relaxing. And even for those individuals, when you relax, it can be something that you love. If you draw, if you meditate, if you do yoga, if you go for a walk, if you like to write. A wonderful thing that I love to do is writing, and so we're going to be talking to you guys a little later in some of the shows to come about journaling for yourself and finding ways of journaling like that, and being able to de-stress yourself and finding other measures and whatever helps for you. So if you have some ideas on ways to relax and things that people can do, why not share it with us? Email us at info@cancertamer.org and give us some of your ideas. Also, that's a wonderful place to ask questions. I am not a medical professional. I am a sexologist, a clinical sexologist, and sex therapist. So my focus is always on relationships. But I'm going to be bringing to you different physicians, different clinicians, different practitioners that are going to be able to give you information on the various different ways of dealing with your life, dealing with your cancer, and healing yourself. And one of the things that I want to make sure that we do when we end our program, I want to end it on a very positive note, and I want to introduce always one person. I call them cancer tamers because they're learning how to tame their cancer and tame their life. And so I want to introduce this segment for actually our very own producer here, Deborah Santulli-Barone.
I think thinking positive, staying positive, and moving the people out of your life that aren't as positive is a good idea. There are people that can't always relate to your cancer, that's fine. It doesn't matter. Be happy, wake up in the day and say, thank God, I woke up, I can eat, I could smile, I could walk, read a book, write what you feel. That really helps. I feel it's a catharsis that help you. And getting involved in a group, a support group, is very important. That's where you really meet a lot of people that can empathize, because as much as your family loves you, they don't really understand completely. And they can love you as much as they want, but they're not there in the war with you. And the war isn't really a war. It's just loving yourself and taking care of yourself, and always advocate. And always advocating for yourself. And I thank Dr. Charley for helping me do that too. It's been great, and I can't wait to come back and tell you some more good things and some more good information at CancerTamer.org. Thank you so much, and always smile.
Okay, and thank you everyone for being here with us today. Make sure you visit our website, CancerTamer.org. Also, tell all your friends about this. It's not just about cancer, it's also about yourself and learning how to help yourself get better, whether you're going through cancer, whether you're going through just stress in your life, or whether you're just learning how to live your life a different way. And that's the way I look at it. I had 53 years with my life one way, got cancer, and now I'm learning a whole new way of living with life. And this is going to be another awesome 53 years that I have. So be ready to find out everything I do, and well, maybe not everything, but a lot of the things that I do, and I'll bring them to you. I'll share them on the website, and please feel free to share your passion, your ideas, your questions. Send them to us at CancerTamer.org, and thank you for being here.